Okay, back here live in the studios, the world opens up. It seems that we are seeing more and more instances of violent outbursts and bad behavior. For example, airlines, they have already reported 3,000 cases of this kind of thing, unruly passengers. They've reported these 3,000 incidences to the FAA this year alone. It's the highest number of cases since they began keeping records back in 1995. We've also seen cases of NBA games marred by disruptive behavior, sometimes violent behavior from fans. What's behind the anger? Is there anything to be done about it? Joining us now is Dr. Ricardo, Whyte. He's medical director of psychiatric health at Community Hospital of San Bernardino, and he joins us now. Dr. Whyte, maybe you can help us understand what's going on here. Good morning.
Good morning, Michaela. Thank you so much for having me.
I imagine, we see these things and are perhaps shocked as lay people, but with your expert eye, what do you see when you see these incidences of unruly behavior in airplanes or in grocery stores or even on the freeways?
As a nation and a world coming out of the global pandemic, what you have is a recipe for a lot of unprocessed grief, trauma. We have sustained such gargantuan loss. And sometimes we've just been forced to pick up the pace and get right back into it. And it puts us at risk of being vulnerable to hijacking of our emotions. Just as we encounter triggers that we never even took the time to identify as triggers, we can have our emotions hijacked.
So a person that would otherwise not necessarily behave like this individual on this airplane might have found themselves at a point where they are triggered, where they wouldn't normally be triggered.
Potentially. And of course, I say this not understanding the intricacies of what took place on the airplane. But this is a great context to have the discussion that it's really important for us to take the time to enhance our self-awareness.
Okay.
Self-awareness is one of the pillars of emotional intelligence. And one of the things self-awareness allows you to do is to understand your mood, but also the thoughts that are behind your mood. Okay. And the luxury of doing that is so that you don't then get hijacked by situations, or at least you're less likely to. And even if you do notice that elevation in your mood, you're in a better position to actually address responding in a more adaptive and productive manner.
So the reality as it stands right now, we are circulating in a reopening world with people who are on this spectrum of levels of self-awareness, right? Some people might be hyper self-aware, and many people may not be, and then there's the gamut in between.
And then not having coping skills as far as what to do when triggered.
Okay, so let's talk about coping skills, because I think that's somewhere we can start.
Absolutely.
So let's say it's in the grocery store and you're frustrated. You're frustrated about the mask policy. You're frustrated. You've had a bad day. And you can feel your heart starting to race. You're getting short-tempered. How can we intervene and self-regulate?
One of the critical things for us to do is to embrace a sense of gratitude. It's very humbling when you think of the amount of human capital that goes into supporting whatever endeavor you have, whether it's going to the grocery store or taking a cross-country trip. I mean, the number of people that are involved in making that possible for you, I think it's very humbling. And once you become aware of that, you become a bit more gracious and understanding that, I really want to be part of the solution and not the problem, in honor of this human capital that is making possible my endeavor, which may be as simple as going to the grocery store.
This sounds a bit like a Jedi mind trick you have to play on yourself, isn't it, Doc?
I take it you love Star Wars.
A little bit. But it takes, to me, what it shows is that we have to be an active participant in finding in this awareness, right? We have to stop ourselves. It used to be breathe, count to 10, take a walk, whatever. And maybe those things still work for you to help you take a beat to sort of get your feet back under you. And then you suggest using gratitude. How about these people that have a trigger reaction, right? We know people that are quick to boil.
Well, see, that's where a lot of times mental health and things like psychotherapy are minimized, but you're less vulnerable to these triggers if at least you take the time to identify the possibility that it may occur. In an airline situation, you're getting that perfect storm of possibly unprocessed grief, but then coming into a very high stress situation.
Yeah.
And it's those moments that really test our ability for resilience and our coping skills.
Well, and by the way, you know, I've been feeling it, I'm sure everybody else at home is, we have been so eager to get back out in the world, but then we find ourselves in the world and a little overwhelmed by the crowds and the safety protocols, and you find yourself almost wanting to shrink back into your protective bubble, your protective cave. So there's a push me, pull me kind of a scenario that's at play inside us too.
No question about it. Besides just the gratitude, I think the next thing you want to think about is empathy. We need to see each other's humanity.
Yes.
We need to understand that those flight attendants are, you know, coaches of their little league teams, and these are people that might be surviving breast cancer, or they might have lost a loved one. We need to see each other's humanity and let that inspire empathy and an understanding that, hey, again, let me try to be part of the solution in this situation.
This is a very individual thing, but we can all play our part again. I mean, we've been talking about all playing our part in keeping each other safe. Now, this is another way of playing our part, right, Dr. Whyte, of playing our part in being good to one another as we move through the world, as we reopen.
Yeah, the efforts to bring us out of this pandemic have been heroic. And the good news is we can play our part as well in terms of, you know, calming things down, having an attitude of gratitude and being empathic towards our frontline workers and those that are servicing us and making our lives better.
They've been through a lot, too. I was reminded of that yesterday when I found myself a little frustrated about how things weren't going super smoothly, and I had to remind myself, they're getting back into the world, too. They're trying their best. They're a little overwhelmed. They're a little shorthanded. Dr. Whyte, would you take my call again if I were to lean on you, as long as I don't have a story ahead of weird breakfast foods that we have eaten as children. I'm sorry you had to listen to that.
Michaela, I won't hold it against you, and yes, I will take your call.
Excellent. Thank you so much. That's Dr. Ricardo Whyte. He's the Medical Director of Psychiatric Health at Community Hospital of San Bernardino. A good reminder to all of us how we can play a part in this and try to avoid some of those scenarios that we've been seeing. 8:52.
Hi.
Hello.
Just to add, when I was a kid, I would pour coffee on my rice when I would eat breakfast.
Oh, so she's still on the breakfast thing. That sounds kind of delicious. Okay, we used to sometimes put a little bit of maple syrup on our cornflakes because we weren't allowed to have sweet cereal.
Oh, yeah, that's good.
That's delicious.
Yeah, that's normal.
Bye, Dr. Whyte.
Doctor's getting ideas for
yeah,
maybe lunch later.